Hello, my name is Asghar Nawaz. I have recently been appointed as consultant cardiothoracic, robotic, and transplant surgeon in Dublin. I also have the privilege to have been awarded the dual national fellowships. One, the first of its kind and very peculiar lung transplant fellowship, and second, the NTN SCTS Ethicon scholarship for robotic thoracic surgery. Mr. Joel Denning, a thorough gentleman and innovative surgeon, is my supervisor and mentor. Although based in Manchester for my post-CCT National Transplant Fellowship, my job plan included at least one dedicated thoracicalist per week. And our transplant director, Mr. Venkat, kindly allowed me to use that for the robotic lists. I had some basic exposure to XI Da Vinci system thanks to Mike Shackloth and Steve Woolley in Liverpool, and then I was traveling to James Cook University Hospital, Middlesbrough, an alternate week for the robotic list with Joel. Although tiresome, but this has been an excellent and rewarding journey of my career. As transplant fellowship was quite busy, few times I drove to Middlesbrough either after retrieval or transplant, as I didn't want to miss the opportunity for robotic cases. Minimal access thoracic surgery is my keen interest, and I have been trying to get on to the robotic route a few years down the line until I met Joel, who kindly supported my fellowship application. And after going through a tough national competitive process, I was awarded the Ethicon Robotic Fellowship. After going through some online and simulation modules and assisting few robotic cases, Joel moves me to the console while he assisted. My first robotic case was right S6 segmentectomy. And it was an amazing experience, and I felt like I reached my dream, although soon I realized this was just the beginning. Following on, I performed robotic lobectomy and a diaphragm. I have to give credit to Joel for being such a patient, polite, and nice mentor that he guided me through each operation. Joel is an innovator, so we discussed some brilliant ideas, and I also had the chance to test some of his new instruments. As part of my transplant fellowship, I visited TGH Toronto, the world's busiest lung transplant center, to have the transplant experience. I was so excited to know that the TGH also have a robot, so I contacted Dr. Yusuf Eko, and I was spending my time in robotic theaters when no transplant activity. During this time, I liaised with the world well-known and prolific surgeon, Dr. Robert Serfolio, who kindly granted me the robotic observership at his state-of-the-art robotic center, NYU Langone, New York, USA. It was such a fantastic and fascinating experience where I saw a variety of anatomical lung resections like lobectomy, segmentectomy, and also the complex robotic operations like robotic chest wall resection and robotic sleeve resections. Serfolio runs his operating theaters very efficiently.
This is a chest wall margin for posterior between ribs. What's that, 3 and 2? Yep. Posterior margin between ribs 3 and 2. Says it. Frozen.
He's quite competent in doing complex robotic cases. And I also had the chance during this observership to sit on the console with these great surgeons. Serfolio Center also performs robotic cardiac cases And out of interest, I went into cardiac theaters to see robotic lima harvest, robotic mitral repair, and redo robotic mitral repair, which was an exciting experience. This enormous exposure has taken my shyness away, and now I feel more comfortable and confident in doing the robotic cases. Robotic is the future of thoracic surgery, and we in Manchester are in the process of getting the robot, the new XI Da Vinci system. My current post in Dublin will allow me to have experience and do the robotic resections, which I will bring back to my own center wherever appointed. I aim to start with the simple cases, but my aim is to do the complex robotic resections like robotic sleeve resections, where my transplant experience will also come into the benefit. At the end, I would like to thank Mr. Shah, the SCTS committee, and the last but not the least, the Ethicon, for awarding me this scholarship through which I had this wonderful experience. Thank you very much.